hypoglycemia and hyperglycemia by Edwards. Hyperglycemia and hyperglycemia by Edwards. Today we're going to discuss about hypoglycemia, hyperglycemia, and the core determinants of hypoglycemia and hyperglycemia. Let's move on to hyperglycemia. Nine symptoms to look out for when experiencing hyperglycemia. We're going to look at if you're urinating more frequently than normal, you're very thirsty. This is known as excessive urination, also known as polyuria. Occurs with glucose buildup in the blood, which causes the kidneys to work harder to eliminate excess glucose. When having higher than normal blood levels causing the person to eat more and lose weight unexpectedly, this is because the body isn't getting enough from the glucose to turn into energy, so it uses the muscles, which muscles in fact to cause weight loss and rapid unexpected weight loss at that. When a person is experiencing consistent tiredness and fatigue, the body doesn't have enough insulin, and the sugar, this is when the sugar stays in the blood rather than getting into the cells to be used for energy. High blood glucose levels can change the shape of the eyelids, which will cause blurred vision, headaches. When this occurs, it can be corrected once the blood is controlled. Having a high blood glucose level can cause nerve damages and affected circulation, especially in lower legs and feet. This may increase the risk for ulcers and unhealed wounds. Having high blood sugar levels over time can cause diabetes neuropathy, which is when you have nerve damage in the lower legs and the fingers, and you're feeling these unwanted pinches that you really shouldn't be having in places where you really don't need to. When you have uncontrolled diabetes, this can cause numbness, skin changes. Your skin can become very dry. Some people become pale, some look like a dark, dusky color. This is signs of insulin resistance. When there is higher than normal blood glucose in the urine, a person can get candidas, allicans, which is a type of yeast infection. Typically, the person would get like a fluconazole, I think it's 150 milligrams, or if it's severe to the point where they need more than 150, sometimes the doctor would order the 250. You can have gum disease caused because of the high blood glucose level. And this can lead to pains in the mouth, gum irritation, so on and so forth. Some of the core determinants are a complex interplay of psychological, pharmacological, and behavioral factors influences both hypoglycemia and hyperglycemia. Medication-related factors, insulin overdose from incorrect dosing and timing, sulfuremias, psychological and metabolic factors, delay in missed meals, excessive physical activities, increased glucose level, hormonal changes, really low determinants. Insulin deficiency or resistance you typically see in your type 1 diabetes and your type 2 diabetes. This is insulin resistant, progressive B Cell failures, this is when your pancreas, you're having pancreas disorders where it's not producing enough insulin. You can have cystic fibrosis. Medication treatment factors, insufficient insulin or oral antibiotic treatment therapy, corticosteroids. Typically now they have the GLP-1s that can help. Some of the lifestyle and behavior factors: excessive carbohydrate intake, sedentary behavior, reduced glucose uptake by muscles, stress and illness increases, hormonal issues. Okay, when you compare the two, you can see they have a lot of similarities. Colon, confusion, vision change, weakness, fatigue, headache, and nausea, those are all under, we can have that with either or, hypo or hyper. Anxiety and sweat and hunger, that you'll see with the hypo. Increased urination, free breath, abdominal pain, and that you'll see in the hyperglycemic. This is a chart that I got from the People 2030, Healthy People 2030, according to CDC. They made a chart to help out with things like these. In conclusion, hypoglycemia is primarily driven by excessive insulin action, missed meals, or impaired counter-regulations, whereas hyperglycemia results from insulin deficiency or resistance, excessive glucose intake, or metabolic stress. Both conditions require careful monitoring, individualized treatment adjustments, patient education, which is always a plus. Thank you.